Hey guys, if you are a doctor or medical student in Malaysia, you have probably heard of all these acronyms: KKM, SPA, JPA, MMC, MMA. It sounds like the whole alphabet soup, right? But each one actually plays a very different role in your medical career. In the next few minutes, let me explain who does what in simple terms. Let's start with the one that everybody knows. The Ministry of Health, KKM, is basically your employer if you are a government doctor. They run most of our healthcare system, such as government hospitals, clinic kesihatan, public health programs, national disease control. It is actually the second largest ministry in the whole country. If you are a house officer, medical officer, or specialist in government hospitals, you are probably working under KKM. Think of it like this. KKM is the hospital system and provides healthcare delivery. They decide things like where you work, hospital operations, clinical policies, training rotations. But here's the key point. KKM does not hire you directly. That is where the SPA comes in. Now, the Public Service Commission of Malaysia, or SPA, is basically responsible for recruiting civil servants into the federal public service. In Malaysia, we actually have got 9 different pihak kuasa melantik, or appointed authorities. SPA is one of the main ones, and it handles recruitment for the federal government and the former federated Malay states. Do you remember which states they are? Other appointing authorities recruit for specific services, for example, the police, armed forces, and teachers. So if you apply to become a government doctor, for example, Pegawai Perubatan UD9, the application goes through SPA. The SPA is responsible for recruiting federal civil servants and also approving the appointments into the public service. In very simple terms, SPA hires you, then they assign you to a ministry. And for doctors, that ministry is usually KKM. With me so far? Let's move on to the third one, which is JPA. The Public Service Department of Malaysia, or Jabatan Perkhidmatan Awam, is the body that manages policies for the entire civil service. They decide things like salary structures, pensions, allowances, civil service schemes, training sponsorships like Hadiah Latihan Persekutuan. So if doctors talk about pay grades, contract versus permanent posts, government scholarships, these policies usually involve the JPA. SPA hires you, KK employs you, JPA decides your civil service rules. Now, we move on to one of the most important ones for doctors, which is the Malaysian Medical Council, or MMC. They are the medical regulator and they are established under the Medical Act 1971, and their main role is to protect patients and regulate doctors. They handle things like registering doctors, issuing annual practicing certificates, maintaining the specialist register, taking disciplinary action against doctors. In very simple terms, MMC decides whether you are legally allowed to practice medicine in Malaysia. Without MMC registration, you cannot work as a doctor, even if you have a medical degree. So some people jokingly call MMC the medical police because they enforce professional standards for doctors in the country. And finally, we have the Malaysian Medical Association. It is not a government body, but a professional association for doctors. Think of it like the voice of the medical profession. They focus on things like doctors' welfare, advocacy, professional development, continuing medical education, and also negotiating issues affecting doctors and more. I'll give you a few examples. The MMA has been at the forefront of contract doctor issues. In fact, in 2019, the first multi-doctor group joint statement was led by the MMA. Fun fact, I was actually a signatory representing MMI doctors at that point of time. Another thing is on-call allowance. You'll be surprised to know that it's actually a relatively recent addition that began in 1994. Before that, you can be on call the whole night and not receive an allowance. Also, MMA had organized town hall sessions with the Ministers of Health for them to listen to the concerns of doctors. This is important because only by participating in healthcare policy discussions can we provide our perspective to the policymakers. MMA has got different sections like SCOMOS, which represents the government doctors, and PPS, which represents the private doctors. And here's a very easy way to remember all of them. SPA hires you, KKM is your workplace, JPA sets civil service rules, MMC regulates doctors, MMA represents doctors. 5 organizations, 5 completely different roles. If you are a medical student or junior doctor, understanding this actually helps a lot. Because when issues happen in healthcare, you know which organization is actually responsible. And that makes a huge difference if you want to solve the issue comprehensively. See you next time.